My name is Dr. Anne Donohoe and I'm the Associate Dean for Thought Graduate Studies at the UCD School of Nursing, Midwifery and Health Systems. So in terms of my background, I'm a registered general nurse, I'm a registered midwife, I'm a registered public health nurse and a registered nurse tutor. I hold a master's in nursing and a PhD in teaching and learning in higher education. My research interests are broad, but they centre around facilitating learning and the student experience. Over the years, I've been very fortunate to work as a lecturer and to work with students at undergraduate level, at graduate level, at master's level and at PhD. And I've held a variety of leadership roles within the school. But if you're to ask me how I got to where I am now, it's because I'm a lifelong learner. Like many of my colleagues, I have a real passion for education and a particular passion for nurse education. So the Associate Dean role is multifaceted. It has a management dimension, it has a governance dimension, and it also has a strategic dimension. And as an Associate Dean, I'm an ex officio member of the school management team and of the school executive. So I'm involved in the day-to-day running of the school, but also in the strategic management of the school. Our students receive a very high quality educational experience, a very high quality clinical experience and a very high quality research experience. So I want to make sure that that continues and develops and evolves, and that's a key priority for me. I'm very well supported by excellent faculty, our programme directors, our heads of subject, our other associate deans and of course our head of school and Dean of Nursing, Professor Timmins. So I see my priorities as our people. Supporting our students, supporting our administrative staff and also supporting our faculty. Within the school, in terms of support mechanisms, we try to foster a sense of belonging, and I think this is particularly important. All of our programs have a named program director and they know the students very well, and our students know those program directors very well. So they feel this sense of belonging. Every program has an administrator, so the students get support with the admin issues as well. In the clinical space, every student has a named assessor, a named preceptor. So they have this sense that they belong. They belong in the school, they belong in the clinical area, and I think that's really important. So it's easier for students to reach out and ask for help if they have this sense of belonging. So that's what I think is a key factor in terms of supporting our students in the School of Nursing, Midwifery and Health Systems. If I was to be limited to one piece of advice, I think I'd start by quoting Aristotle, who's reputed to have said, "While the roots of education are bitter, the fruit is sweet." And what he meant by that is that the educational journey is complex, it can be challenging. And I think that's particularly important for our graduate students to recognise that. But my piece of advice would be to work hard, to stay the course, and they will succeed. So that would be my one piece of advice. Work hard, stay the course, and success is just around the corner.